Hi, my name is Dr. Robert Schwartz. I'm chairman of the board for the American Academy of Thermology. The American Academy of Thermology is the premier organization in North America for the scientific development, healthcare training, and clinical application of medical infrared thermology. We have internationally peer-reviewed guidelines on neuromusculoskeletal, breast, oral systemic, and veterinary applications for medical thermology. We are a 501c3, which means we're a nonprofit organization. What is scientific medical thermology? Scientific medical thermology is the study of infrared radiation for medical purposes. Infrared detection is converted to temperature readings to provide an assessment of physiology. It has applications for neuromusculoskeletal, breast, oral systemic, and veterinary disorders. Largely, skin temperature is controlled by the vasculature. Vascular can vasoconstrict or it can vasodilate, and that can affect skin temperature. Likewise, there can be problems with trauma, local inflammation, and other things such as burn that can affect skin temperature. Medical thermology is safe and inexpensive. It's an imaging modality that validates complaints, serves as an extension of the physical examination, and can assist with decision making. It's a physiologic study that provides information that is simply not available with any other objective structural assessment. In this particular thermal image, you'll see a temperature palette with a 12 degrees centigrade range. Each color here is demarcated by 1 degree centigrade change. Basically, don't expect to take a hot glass of water, put it in the refrigerator, and come back to it after it's equilibrated with one half of it hot and the other half of it cold. You expect it to equilibrate as well. And we expect you to do that. So for example, you can see in this particular case, the left upper extremity is clearly greater than 1 degree centigrade change from the right upper extremity, with more involvement in the fingers than proximally, but still the whole limb is cold on left. That's not a normal situation. Thermography measures and maps skin temperature, the surface skin temperature. Mapping provides an insight into what might be generating that. If you're trained in what we call dermatomes, which is the distribution of where nerve endings end on the skin, or even myotomes, where nerve endings supply particular muscles, or sclerotomes, which are sympathetic nerve fibers that supply things such as ligaments and fascia and other soft tissues, or even vasoterms, where the peripheral arteries end in certain distributions or regions of the body, you're able to look at skin temperature changes and say to yourself, this correlates or helps me identify what might actually be causing these skin temperature changes. We call those generators into the abnormal sympathetic response. They provide what we call vasomotor maps. They're a map or a visual representation of where the skin temperature changes are. And by knowing that vasomotor map, you can, in your mind's eye, frequently correlate them to things such as myotomes, dermatomes, or sclerotomes, and the like. If you're familiar with skin galvanic impedance studies, then we can tell you that thermal imaging changes directly overlap and map changes in skin galvanic impedance. Images obtained under cold stress, and we have specific guidelines on how to do a cold stress test that can be found on aathermology.org's website. Then the sympathetic skin response studies can be used to assess what we call a dysautonomia, the autonomic nervous system, things that occur automatically, such as your pupils dilating when it's dark, your heart beating when you get scared, your increasing your bowel motility or your bladder telling you to empty, things like fight or flight, or even breathing. Things that you're not supposed to think about in order to make happen are called the autonomic nervous system. And that's also true if your fingers swell when it's hot or if they constrict when it's cold. And so if you put somebody under a cold stress environment, you can assess or challenge the sympathetic system and see whether or not it's working properly. And hence, vasomotor maps of that and visual imaging with infrared thermology helps you find out if there's something called a dysautonomia. They're more common than you think. It is not a picture of pain. Like any other study, clinical opinion is required to ascertain the causation, the causation or the generator of the objective finding. There are several neuromusculoskeletal conditions that have thermographic findings. Fibromyalgia can show localized hotspots. Post-herpetic neuralgia can show changes in skin temperature in the distribution of where a viral neuritis may have occurred. Thermology is uniquely suited to assess weather-sensitive pain. People say that the weather makes their pain hurt. That's largely autonomic, sympathetically derived. Small fiber neuritis, such as a viral infection, for example. Failed necks and backs, people that have had neck and back surgery that failed and continues to cause pain. Dysautonomia, as we've talked about. Fibromyalgia would be one, thoracic outlet syndrome would be one, cluster headaches are also a dysautonomia, and other conditions that are simply not going to be visible with structural imaging. Atypical head and neck pain would be a very good example of that. When cold stress examinations are performed, the sympathetic skin response study can validate several neuromusculoskeletal complaints that are otherwise simply not readily discernible. Breast thermology is also a scientific medical thermology study when done according to AAT guidelines. However, it is completely different a set of findings that regulate its usefulness. It's a thermal findings assessment. It's an adjunctive study. It's an extension of the physical exam. It's an assistant to other structural studies. It's not a standalone study when it comes to breast. It simply measures breast skin temperature. That is dependent on physiology. It's not a structural study. Things like inflammation, metabolic changes, and vascularity can have an impact on the findings. Indications would include dense breasts, small and fibrocystic breasts, people that have had an implant or that are post-mastectomy, and proactive patients that have reasons for concern about their breast health, where they're not wanting to rely upon only a structural study which tells you when something already is there. They're trying to do something about it before it's there. Breast thermal studies are frequently used for cancer detection. Most studies today, however, do not follow scientific medical thermology guidelines. They're frequently offered by adjunctive clinics, clinics that are not necessarily medical offices, that are simply more holistic in their health model, but not necessarily licensed medical doctors or physicians. It's trying to address many of the shortcomings, however, of conventional structural studies, and patients and the general public still is asking for it, even in those environments. One problem with breast studies is that reporting of findings varies widely because most often when it's not done in a medical orientation, even at times when it is done in a medical physician's orientation, how to differentiate impressions or thoughts from the findings in medical report writing can vary widely if you're not trained. Breast studies typically do not consider other applications. If you get a breast thermology examination or a breast thermography examination, in particular from an alternative clinic, they're not going to really know about medical applications. So in this particular examination of the breast, you'll see it's a front view only. It's a color view. Frequently you get grayscales, as we showed earlier, but it does look like there's a change from side to side, and you might say, for example, just because the right side of the breast or your left side as you're facing the image looks hotter or warmer, and that entire region maybe is something suspicious. But if you were to add or into that image the lateral arms, you'll see that the arms themselves actually are not the same temperature. In fact, they're quite a bit cooler on that left side. And if you add the volar aspect of the arms and the dorsal aspect of the arms, you'll see that the entire arm is cool on the left side. So extra views can help mitigate the breast paradox and change your impression. The breast paradox being that most people looking for breast thermology studies are trying to look at physiology and trying not to rely solely on structure, but at the same time they're not considering structure or anything else at all, which means they're only getting a limited view. This particular person, by the way, has a left subclavian steal syndrome, which is a vascular disorder that's coming out of the head and neck going into the torso of the body, and it really had nothing to do with breast at all. Veterinary Thermology. Indications include assessment of musculoskeletal conditions, shoe and hoof balance, saddle fit, and regulatory compliance screening for application of foreign substances and soaring agents. Most of these indications are for equine, however there clearly are other neuromusculoskeletal indications for large and small animal, as we have otherwise described already in the neuromusculoskeletal guidelines. Most studies done today for veterinary thermology are for equine or equestrian studies. But that's because owners have a bigger investment in horses as compared to small animals. Scientific medical thermology, however, can be quite useful in small animals and in exotic animals as well. Oral systemic thermology. Applications include skin temperature assessment for fever detection, domestic violence cases, dental oral disease, dermatologic disorders, and other specified conditions. There's quite a few of them. We refer you to the AAT Oral Systemic Guidelines. Fever detection has, however, gone mainstream, especially because of the COVID world that we've all been living in. It has greatly increased awareness of temperature measurement. Most evaluations, however, being performed for temperature screening are not being done properly and they're not really useful. We're using equipment that was never really designed for medical applications, and they're not following testing protocols that make sense. I don't think most people would measure their child's forehead with a commercial grade infrared detector and feel comfortable after they've been playing in the dirt or the sand outside and say, gee, I actually measured the temperature to see if they have a fever or not. Yet frequently that's what someone does when they've been walking in the sun and then go outside and enter a store for a screening. Findings and impressions. Thermographic findings speak to the distribution, localization, or presence of objective data. Thermographic impressions speak to known patterns, maps, or signatures. A finding might be that there is a temperature asymmetry pattern, that the left arm, forearm, finger, whatever region of interest we're describing, is not the same temperature as the right side. The thermographic impression would say, but I see this all tracking a certain distribution, and clinically that means something to me. Clinical impressions say, when I see it in that distribution, what's actually generating it or causing it in that in particular patient. And in order to give a clinical impression, you have to do a complete history and physical of that patient yourself. The AAT IIRR Marketplace is one attempt to try to interfere or intervene in some of these issues so as to improve the science of medical thermology. AIIR stands for Infrared Imaging Report Resource. Basically, this is a marketplace where we connect properly trained technicians who take the studies and interpreters for report generation. We also offer structural support tools and platforms to help standardize reporting. The AAT IIRR Imaging Alliances, which is the Artificial Intelligence Infrared Imaging Alliance, is a group of internationally peer-reviewed professional organizations that will look at protocols, ways studies are taken, and then correlate that data with machine learning or artificial intelligence or deep learning so as to be able to say, this is what we call a thermal signature. When you see this particular set of thermographic findings, it actually has more clinical relevance. We provide professional support in AI data trend analysis, and we're going to help promulgate infrared imaging advances that promote the field. In general, scientific medical thermology is felt to be highly sensitive, but a highly sensitive study, but with the exception of several neuromusculoskeletal conditions, it's basically not a diagnostic study. And that's because it's too sensitive, but not specific enough. The lack of the specificity can be overcome by focusing on its virtues as a thermal findings assessment and not saying too much about the clinical conditions without having done a physical exam. Making sure that you use the study as an adjunctive study or as an extension of your physical exam makes the sensitivity a strength, as opposed to making specificity a weakness. In addition, the application of artificial intelligence on approved protocols can minimize the lack of specificity and highlight the strengths that sensitivity offers. We hope that you'll log on to American Academy of Thermology's website, aathermology.org. We have numerous educational resources, training sessions, and host annual scientific sessions, as well as the Infrared Imaging Report resource and the Artificial Intelligence Alliance. Thank you very much.